everyone, Dr. Joanna here with Momenta Chiropractic, and today I'm going to take you through some of the assessment when we are trying to figure out if the IT band is the cause of a patient's lateral knee pain. So I have Dr. Green here today. He's going to help me demonstrate some of the tests that we do, starting with a test that compresses the outside of the knee as we go through some flexion and extension of the knee. So for this, I'm going to bring the patient's knee to a flexed position, apply some pressure at the outside of the knee, and then have him go ahead and straighten and bend the knee. And as Dr. Green had mentioned in the first video, talking about what IT band syndrome is, a common cause of IT band syndrome is compression of the fat pad that sits right beneath the IT band at the lateral portion of the knee. So we're basically trying to reproduce that compression with this test here to see if that's positive and give us some information as far as if the IT band might be causing the pain. Next, we're gonna test some of the muscles in the glutes, because the glutes are a major stabilizer of the knee and keeping our knee in proper alignment while we're doing things like running, squatting, and lunging. So for this test, we're gonna have the patient raise up their leg and bring it slightly extended in the hip, and then we're gonna muscle test and see how the muscle reacts to a little bit of force. See how it's engaging, if it's strong enough to hold that contraction there. If we had some weakness here, it would indicate that we have some sort of issue with our glute muscle strength that might be causing the IT band syndrome. The next portion of the exam is a movement assessment. So patients that are complaining of lateral knee pain, we'll take them through a series of different movement patterns to assess how the knee is performing through those movements. So I have Dr. Green here to demonstrate a couple of them that we like to start with. Number one being a double leg squat. So he's just going to show us a normal body weight squat the way that he typically would throughout his training or his workouts. And what we're specifically looking for with the assessment of IT band syndrome is the position of the knee and how it's tracking over the foot throughout the squat. If we have some sort of hip weakness, we're gonna observe this collapse happening in the knee. It's kind of drifting toward the midline throughout the descent of the squat, and as he comes back up, it might correct itself. So the double leg squat is looking pretty good. We're gonna take that a step further and assess a single leg squat. So same thing here, we're looking how the knee is tracking over the foot throughout the squat. If it's collapsing inward, that's gonna, again, tell us that something might be going on within the hip, either some strain of some sort, weakness, or just improper muscle coordination throughout the hip that would cause that knee to collapse in. Those are just a few parts of the exam when we are testing for IT band syndrome. Based off the results that we find during the exam, that's going to indicate where we take our treatment, which we're going to demonstrate in the next video, all about treatment, soft tissue therapies for IT band syndrome, followed by some of our favorite exercises to prescribe patients that are dealing with IT band syndrome.